Every 2 minutes, somewhere in the world, a person dies from liver cancer. And the most terrifying part? Most of them had no idea anything was wrong until it was already stage 3 or 4. Liver cancer doesn't announce itself. It doesn't send you a warning letter. It grows quietly, invisibly, while you go about your normal life. You might feel a little tired, maybe some bloating after meals, a dull ache in your side that you chalk up to sleeping wrong. And you ignore it, because it doesn't feel like cancer. But here's what you need to know today. The liver is one of the only organs in your entire body that can lose up to 75% of its function and still keep going without you feeling a thing. That's not a superpower. That's a death trap. In this video, I'm going to show you 13 of the most dangerous warning signs of liver cancer, including 4 symptoms that doctors say are almost always missed on the first visit. Stay until symptom number 10. What I'm about to tell you has shocked medical audiences around the world. So here's the question we need to ask first. Why does liver cancer kill so many people when the liver is literally inside your body? Great question, and the answer is both fascinating and frightening. The liver is your body's largest internal organ, roughly the size of a football, sitting on the right side of your abdomen, just under your rib cage. It does over 500 jobs every single day. It filters your blood. It produces bile for digestion. It stores energy. It removes toxins. It makes proteins that help your blood clot. And because it's so powerful, so resilient, early-stage liver cancer can grow for years before you notice a single symptom. By the time most people feel sick enough to go to the doctor, the cancer is already advanced. In fact, the 5-year survival rate for liver cancer caught at a late stage is less than 3%. 3%. But here's the flip side. Liver cancer caught early, before it spreads, has a survival rate of up to 36%. Some studies put it even higher with surgery. That gap, between 3% and 36%, that is the gap that knowledge fills. So let's fill it. Right now, 13 signs. Pay attention. Symptom number 1, pain or discomfort in the upper right abdomen. Number 1, pain or discomfort in the upper right side of your abdomen. This is one of the most reported early signs of liver cancer, and one of the most ignored. People describe it differently. Some say it's a dull, heavy ache. Others call it a feeling of pressure or fullness, like something is sitting under their ribs on the right side. Some feel it radiating up into the right shoulder blade. Here's why it happens. As a liver tumor grows, it stretches the capsule, the fibrous outer layer of the liver. That capsule has nerve endings. When it stretches, you feel it. The key word is persistent. A one-time twinge means nothing, but a dull ache under your right ribs that keeps coming back for more than 2 to 3 weeks. That is your liver trying to speak to you. Listen to it. Symptom number 2, unexplained weight loss. Number 2, rapid, unexplained weight loss. We covered this in our pancreatic cancer video, and it shows up here too, because cancer shares this pattern across many types. With liver cancer specifically, weight loss happens fast. We're talking 10, 15, even 20 pounds in a matter of weeks, without changing a single thing about your diet or exercise. Why? Because the liver is central to metabolism. When cancer disrupts liver function, the body loses its ability to store and use nutrients efficiently. The body begins to break down its own fat and muscle for energy. This is called cancer cachexia, a wasting syndrome, and it's one of the most visible red flags oncologists look for. If someone you love is losing weight fast and doesn't know why, please encourage them to see a doctor. Today, symptom number 3, loss of appetite. Number 3, a significant, lasting loss of appetite. Not just, I'm not that hungry today. A deep, persistent disinterest in food, sometimes with nausea at the thought of eating. The liver plays a key role in digestion. When it's compromised, digestion suffers. Food feels like a burden. Patients often describe feeling full after just 2 or 3 bites of a meal. Combined with weight loss, this creates a dangerous cycle. The body needs nutrition to fight, but the disease itself prevents eating. What makes this tricky is that many people blame stress, a busy schedule, or aging. Months go by. The real cause goes undetected. Symptom number 4, jaundice, yellow skin and eyes. Number 4, jaundice. We talked about this with pancreatic cancer, and it shows up with liver cancer too, because both diseases affect the bile system. When liver cancer damages the liver's ability to process bilirubin, a yellow substance produced when red blood cells break down, bilirubin builds up in the blood. Your skin turns yellow. The whites of your eyes turn yellow. Your urine darkens to a deep amber or brown. Your stools turn pale or clay-colored. Jaundice from liver cancer can feel different from other types. It often comes on gradually, starts with the eyes, and spreads to the skin over days or weeks. Never, and I mean never, ignore yellow eyes or skin, no matter how mild. This is your body sending a 911 call. Symptom number 5, swollen or distended abdomen ascites. Number 5, and this one surprises most people, a swollen, bloated abdomen that doesn't go away. The medical term is ascites, pronounced ascites, and it means fluid is accumulating inside your abdominal cavity. Here's what happens. Liver cancer damages the liver's ability to produce albumin, a protein that keeps fluid in blood vessels. When albumin levels drop, fluid leaks out of the vessels and collects in the belly. The abdomen can swell so much that it looks and feels like pregnancy. Patients describe feeling heavy, tight, and constantly uncomfortable. Some people wear it for weeks thinking it's just bloating or gas. They take antacids. They cut out dairy. Meanwhile, the fluid keeps building. If your belly is swelling, especially asymmetrically, or if it feels hard and full, please get it checked immediately. Symptom number 6, extreme fatigue and weakness. Number 6, a level of fatigue that goes beyond tired. I'm not talking about needing a second cup of coffee. I mean the kind of exhaustion where getting off the couch feels like running a marathon, where you sleep 10 hours and still wake up feeling empty. Liver cancer fatigue is systemic. It comes from the inside out. The liver is struggling to detoxify the blood, regulate metabolism, and produce essential proteins. The body is working overtime while getting less and less support. Combine that with poor nutrition from loss of appetite, and you have someone who seems to be aging 10 years in a matter of months. Fatigue alone rarely triggers a cancer investigation, but fatigue plus any other symptom on this list, that combination demands action. Symptom number 7, nausea and vomiting. Number 7, persistent nausea and vomiting. Nausea with liver cancer often doesn't come in the morning, like pregnancy nausea. It's unpredictable, sometimes worse after eating, sometimes constant. The liver produces bile, which helps digest fats. When liver function is impaired, bile production becomes erratic. Food doesn't digest properly. The result is nausea, vomiting, and a general feeling that your digestive system is completely out of sync. People spend months visiting gastroenterologists for what they assume is an acid problem, when the real issue is sitting in the liver. If nausea has been your daily reality for more than a few weeks and nothing helps, go deeper. Ask for imaging. Symptom number 8, itchy skin. Number 8, relentless itching, all over the body, with no visible rash. This is one of the symptoms that drives patients absolutely crazy, because it's invisible to everyone around them, but unbearable to experience. When the liver can't process bile properly, bile salts spill into the bloodstream and deposit under the skin. These salts irritate nerve endings from the inside. The itch can be mild at first, just occasional scratching, but it can become so severe that patients can't sleep. They scratch until they bleed and still feel no relief. If you're experiencing whole body itching with no skin condition, no allergy, no rash, and especially if you also have any yellowing of the skin, please see a doctor as a matter of urgency. Symptom number 9, fever without infection. Number 9, and this one surprises people, a low-grade fever that comes and goes without any obvious infection. Most people associate fever with a cold, flu, or infection, but with liver cancer, a persistent low-grade fever, usually between 99 degrees Fahrenheit and 101 degrees Fahrenheit, can be caused by the tumor itself. Liver tumors can trigger what's called a paraneoplastic syndrome, where the immune system reacts to the cancer by releasing inflammatory chemicals that raise body temperature. The fever comes and goes. No sore throat, no runny nose, no explanation. Doctors sometimes treat it as a mysterious infection for weeks before liver imaging reveals the real cause. An unexplained recurring fever, especially in someone over 50, should always prompt a thorough investigation. Symptom number 10, a palpable lump under the right ribs. Number 10, and this is the one I promised you earlier. Some patients, not all, but some, can actually feel their liver cancer. As a tumor grows inside the liver, it can enlarge the organ significantly. In some cases, a doctor pressing on the right side of the abdomen can feel a hard, irregular mass. In advanced cases, the patient themselves can feel it, a hard lump or fullness directly under the right rib cage. Here's what's shocking. Several patients in documented case studies reported feeling this lump for 2 to 4 months before seeking help, because they assumed it was a muscle or a benign cyst. A hard, painless lump anywhere in or on your body is never something to wait and see about. If you can feel something unusual under your right ribs, especially combined with any other symptom, do not wait. Call your doctor today. Symptom number 11, sudden worsening of liver disease, cirrhosis. Number 11, and this one is critical for the millions of people who already have liver disease. If you have cirrhosis, scarring of the liver from hepatitis B, hepatitis C, alcohol use, or fatty liver disease, and your condition suddenly gets dramatically worse without a clear cause, liver cancer may be the reason. Cirrhosis is the single biggest risk factor for liver cancer. Around 80 to 90% of liver cancer cases worldwide develop in a liver that already has cirrhosis. So if you or someone you know has liver disease, and they suddenly experience more fluid in the abdomen, confusion, deeper jaundice, or rapid deterioration, this is a medical emergency. People with cirrhosis should be having ultrasound scans every 6 months specifically to screen for liver cancer. If you have cirrhosis and your doctor hasn't mentioned surveillance, ask about it directly. Symptom number 12, confusion or mental fog, hepatic encephalopathy. Number 12, confusion, forgetfulness, personality changes, or mental fog. This one is particularly heartbreaking because family members often mistake it for aging, dementia, or stress. Here's what's actually happening. When the liver is failing, it can no longer remove ammonia and other toxins from the bloodstream. These toxins reach the brain, and they interfere with normal brain function. The medical term is hepatic encephalopathy. It can look like confusion, difficulty concentrating, forgetfulness, mood changes, poor judgment, and in severe cases, disorientation and loss of consciousness. Family members are often the first to notice. Dad isn't himself. Mom seems confused lately. He's been saying strange things. If someone you love has known liver disease, or has any of the physical symptoms we've discussed, and they start showing mental changes, please take them to the emergency room. Not next week. Now, symptom number 13, shoulder or back pain on the right side. Number 13, pain in the right shoulder or upper right back. This one confuses people because it seems so far from the liver. How does liver tumor cause shoulder pain? The answer is a nerve called the phrenic nerve. It runs from the neck down through the diaphragm. When a liver tumor presses on the diaphragm, the muscle below the lungs, it irritates the phrenic nerve. And the phrenic nerve refers that pain upward to the right shoulder and upper back. This is called referred pain, the body's communication system routing a signal to the wrong address. People visit chiropractors and physiotherapists for months. They get massage therapy. They buy new pillows. The shoulder loosens up temporarily because the massage relaxes the surrounding muscles, but the pain always comes back. Unexplained right shoulder pain in someone with any other digestive or liver symptoms is a red flag that requires abdominal imaging. Okay, now I want to hit you with some facts about liver cancer that I guarantee most people don't know. Fact 1, the global scale. Liver cancer is the 6th most common cancer in the world, but the 3rd leading cause of cancer death. It kills far more people relative to how many it affects than almost any other cancer. The reason is simple: late diagnosis. Fact 2, the hepatitis connection. Worldwide, about 80% of liver cancer cases are directly linked to chronic hepatitis B or hepatitis C infection. Many people carry these viruses for decades without knowing, because hepatitis often has no symptoms either. If you have never been tested for hepatitis B or C, get tested. It is a simple blood test. It could save your life. Fact 3, alcohol and fatty liver. Non-alcoholic fatty liver disease, NAFLD, now affects about 25% of the global population. It is the fastest growing cause of liver cancer in the developed world. You don't have to drink alcohol to get it. Obesity, diabetes, and a high sugar diet are enough. Fact 4, the surprise. A 2022 study found that people with type 2 diabetes have up to 2.5 times the risk of developing liver cancer compared to non-diabetics. Insulin resistance, it turns out, is not just a metabolic problem, it's a cancer risk factor. Are you diabetic or pre-diabetic? Ask your doctor about your liver. Fact 5, the age shift. Liver cancer used to be a disease of the elderly, but over the last 20 years, diagnoses in people aged 35 to 55 have risen sharply, largely due to the rise of fatty liver disease in younger populations. Liver cancer is no longer just a concern for older adults. Fact 6, the screening gap. Unlike colon cancer, which has a standard colonoscopy screening, liver cancer has no universal screening program for the general population. The only people routinely screened are those already known to have cirrhosis or chronic hepatitis. This means millions of people at moderate risk have no safety net. What to do now? So what do you do with everything you just learned? Let me give you a clear, simple plan. Step 1. Get a hepatitis test if you never have. Hepatitis B and C are the leading causes of liver cancer globally. A simple blood test tells you everything. If you test positive, treatments today are incredibly effective, especially for hepatitis C, which is now curable in over 95% of cases. Step 2. Know your liver. If you have any history of fatty liver, cirrhosis, heavy alcohol use, or hepatitis, you are in a higher risk category. Talk to your doctor about liver ultrasound surveillance every 6 months. Step 3. Don't dismiss abdominal symptoms. Pain under the right ribs, bloating that doesn't resolve, unexplained weight loss. These aren't things to wait out. Get them investigated. Step 4. Watch for the combination. One symptom can have dozens of explanations, but 2 or 3 of the symptoms on today's list appearing together, that pattern is significant. Document them, write them down, and bring that list to your doctor. Step 5. Protect your liver now. Limit alcohol. Manage your weight. Control blood sugar. Get vaccinated for hepatitis B if you haven't. These are not just lifestyle choices. They are cancer prevention strategies. The liver is extraordinary. It regenerates. It fights. It adapts. But it cannot fight what it cannot tell you about. You just became one of the people who knows what to listen for. Use that knowledge. Share it. It matters. If you made it to the end of this video, thank you. That tells me you care about your health and the health of the people you love. And that means everything. If this video gave you something valuable, a symptom you'll now watch for, a conversation you're going to start, a doctor's appointment you're going to book, please hit that subscribe button right now. Every week, we release a new health awareness video covering the symptoms, conditions, and medical facts that can change and save lives. And please share this video. Send it to a family member. Post it in a group. Drop it in a chat. You never know who needed to see this today. Coming up next, we're covering the 13 most dangerous signs of kidney cancer. Another silent cancer that rarely causes symptoms until it's already spread. Click that video now and let's keep learning together. Take care of your liver. Take care of yourself. I'll see you in the next one.